Hello everyone, I'm Dr. Adora Ayin, co-founder and chief operations officer at Oncopadi Technologies Limited. Today we're gathered to talk about last mile cancer technologies that are improving access to cancer care in Africa.
You've highlighted, what would you say is one of the areas in some of these resources that are still lagging behind? So I know you talked about telemedicine or digital health solutions. You also talk about some of the palliative care and patient-reported opportunities that lie. So which of these areas are still lagging behind and still require more efforts in supporting patients or people living with cancer?
Yeah, that's a really good question. I think the research field generally, in terms of translating, findings from the context of high-income countries. So, for example, I mentioned the VASH in the US study. There's still, I think, across all applications of digital technology for cancer care in lower resource settings, there's a need to really develop the evidence base across a wide range of applications. So I don't think there's any one particular application or use. I think there's a real opportunity for research and development of all types of digital health approaches. I guess one kind of exciting bit is, and it hasn't been explored today, is prognostic modelling. So using data from clinical systems, from patient records, and combining that with maybe patient-reported outcomes data to understand what the possible trajectory of somebody's illness might be in the future to really inform clinical decision making. It's an exciting area that's being developed in the context of high resource settings, but increasingly, thinking about Lagos and the cancer centre, the digital data that's being collected there is getting ever more granular and detailed. There's real opportunities to apply some of those approaches like prognostic modelling as that infrastructure develops.
Right, fantastic. Really exciting technologies that are being developed. Now, to speak more on research, Dr. Salako, we know that Oncopadi has launched 2 hubs in the College of Medicine, University of Lagos, and the Olabisi Onabanjo University Teaching Hospital in Ogun State. Can you share with us how these hubs are generating, insightful data and clinical services for cancer patients?
Thank you for the question. So the hub in College of Medicine, University of Lagos is more of an academic hub where medical students, nursing students, and anyone in the academic community comes in with their digital health idea. And our goal in the hub is to nurture that idea. Everyone, or most people will agree with me that Nigerians and many Africans are talented. And there's a lot of brain power in our universities. Unfortunately, our curriculum is undergoing, if I may say, reconstruction, much needed reconstruction. Because a lot of medical students and academicians have ideas in digital health, but the curriculum does not fully support or provide that enabling environment. When I say enabling environment, I'm talking about investment, resources, manpower dedicated to bringing the idea from dream stage to reality or to a product. So what we do at the hub in the Department of Radiotherapy, College of Medicine in Diaraba, is these ideas. We nurture them and then bring them to life. But more importantly, just to reiterate what Matthew said earlier, is to provide evidence. For us in the medical community and digital health community, it's important to publish your work, do research to learn new insights. And one of such is the PROS tool. So a lot of cancer patients, when we treat them in the hospitals, they go back home and they have a lot of side effects. And we all know that many hospitals shut down by 4 or 5 p.m. So what does this tool do? It allows you to report your side effects. It is a very simple tool, a web application, where a patient who is at home 7 p.m. or weekend can report their side effects. I'm having diarrhea, I'm having pain. the pain is this serious, it grades it, and at the back end, a healthcare professional is able to see the symptoms, grade the symptoms, and then provide medical advice. In instances where the side effect is serious or severe, for example, a patient having diarrhea 7 times, a cancer patient having diarrhea 7 times is an emergency. Such a patient will be invited into the hospital through the accident and emergency. And that's a tool that we have just piloted in Lagos University Teaching Hospital. We onboarded about 137 cancer patients. They reported more than 40,000 side effects. And so for the first time, we are hearing from our patients, not from the clinic or from the comfort of their home through this technology. So our goal is, for this type of technology, it is about delivering care to the patient, whether they are right in front of us or they are outside the 4 walls of the hospital.
Question from my panelists. So I would like to start with you, Dr. Adeniji. Now we know, we've had some of the insightful work that BPO is doing in using technology as an enabler for cancer care. Can you share with us maybe one particular pain point of patients that you've encountered that would say these areas are lacking when it comes to supporting cancer patients? One pain point of patients.
Thank you very much. So, in quick word, like Dr. Salako said earlier on, that we have few oncologists all over Nigeria, and sometimes when we say Nigeria is the giant of Africa, many of us don't believe that because we look at things happening in Nigeria. But there are many African countries that don't even have up to 20% of what we have. For example, there are African countries that don't have one oncologist in the entire country. And I've had the privilege of consulting for one of the top officials in that's Liberia. They don't have a single oncologist. And they, because they have the resources, they have to travel to the US, travel around the world to be able to access care. But when I thought about it, I'm like, this is ridiculous. Liberia, a big country. So, when I see things like that, I know it's lacking, number one, even outside of Nigeria to start with. And then we also have states, like Dr. Salako said, that don't have oncologists within Nigeria. So the support, like a lot of clients or patients, they travel into Lagos, Abuja, and a few other states to be able to, meet oncologists and get the best treatment. But in terms of support for cancer patients, I want to say number one, there's something we call patient navigation, where someone that counsels the patient or the client and tells him how to go about accessing this care. It's lacking in Nigeria. That one is confirmed. Most of the time, the oncologist will have to double as that to be able to guide the patient. And then another support is the gadgets or the medical equipment that we need. For example, radiotherapy. The number is building up in Nigeria now, but it's still very few. A lot of people still travel around, go through the stress of journey to be able to access good one. And I'm not talking about, because when we talk about cancer care digital, it applies to everything from health record keeping, even to radiotherapy. Now there is something called digital radiotherapy care, where you can, talk to someone outside your center. Someone outside your center can actually control your patient for you. Or you have a patient and you don't have time. Not just I will control you from South Africa, from India, from US, from UK, Canada, and you use that plan. Just okay, this plan is fine. You move ahead instead of the patient waiting until you're done, because you have a lot of patients too. So digital support, navigation, and then the best of the equipment for cancer care. Thank you.
Fantastic. So we know that patient support, digital navigation, and the ability to share digital radiotherapy are some of the ways. So Abiodun, please, I would like to ask you, can you highlight for us some other opportunities that you think still lie with your organization in actually supporting, some of these health technologies that can solve some of the health problems in low and middle income countries? What opportunities are present?
Okay, I'd like to say that opportunities abound, of course. ACT Foundation was just about 5 years old, and in our 5 years, because we focus on health, environment, entrepreneurship, and leadership. And even in all of these 4 focal areas, health takes a huge chunk of the kind of granting that we do. I guess the audience knows that ACT Foundation is a grant-making organization, and we work with the likes of Chebekli, Cancer Care, and other non-profits in Nigeria, across Africa, who are actually solving problems for the vulnerable. And even in health, cancer care, maternal health care is also like in the front burner for us. And for us, what we do every year, we make our application and grants applications available, so people just need to look out for the funding, apply for it, and then once they are reviewed, they get to work with us. In the past 5 years, thanks to the likes of Shebekli and some other cancer non-profits that we work with, we've been able to reach over 300,000 beneficiaries with information on cancer care. Over 30,000 have been trained. We've also been able to train health professionals, nurses, pharmacists, doctors, who have been able to help with the navigation issue that Dr. Adeniji talked about, making sure that information is available, getting screening, providing navigation to treatment, and then providing other forms of support, of course, training, capacity building as well. And these are some of the huge barriers that we have. The issue of culture, people not knowing, that they could even do self-examination by themselves. And then if they find something, when you talk, you can then reduce age presentation issue and all of that. So at ACT Foundation, we're striving towards increasing, even the quotas that we give to cancer care through partnership with other funders, that are available. So opportunities abound. There are international organizations who are willing to, to do this. World Health Organization, the likes of Bill and Melinda Gates Foundation. I was really happy to hear that, Roche is partnering with the federal government to reduce, to subsidize cancer care in Nigeria. By 80%, that's a lot. So people actually need to understand that the opportunities are here, and they just need to look out for the information. And with such efforts, and with our efforts, and with some other donors also putting efforts into things like this, I believe that the opportunities abound, and it will only get better, and hopefully we'll get to close the gap in cancer care. Next call, okay, since you asked. So the last grant call is still going through review, and we are at the final stage, and by the time the review is done, and we get the results, and then we onboard our grantees for this set, and then the next grant comes up in October. So people would need to follow us on social media to
please follow ACT Foundation.
ACT Foundation _ on Instagram, ACT Foundation on LinkedIn, Facebook. Yes, and Twitter.
Fantastic. So all our innovators in the house, all our change agents, all our health solution providers, please reach out to ACT Foundation and get, that money to support, cancer treatment, to advance cancer care, to expand access and improve the patient experience. And I just want to get in 1 minute, what key takeaway from this session do you want to leave our audience with? And I'd like to start with you, Dr. Salako. Is one key takeaway?
So I would say we should all take our health very seriously. We should book our medical checkup, especially for ladies. Certain cancers are preventable, like cervical cancer, and technology is changing the way we screen. And one of the products we have now at Shebekli is the HPV DNA self-sampling kits. So gone are the days where you have to come to the hospital and open up to a doctor. With this kit, you can test yourself in less than a minute. As in, once you purchase it, you go into the bathroom and you just take it. It's a tiny stick in there. You take it into you just use it to swab your private part. Inside your private part, all of the instructions are there. You put it back in the bag, and then you send it to us, or we collect it from you. And you get your test results in about 2 weeks, and it says whether the virus which causes cervical cancer is there or not. So my take-home message is book your medical checkup, whether you're a man or a woman, and especially women. Cervical cancer is preventable, it's caused by a virus. There's a self-sampling kit that tells you if you're positive or negative, and if we find that you're positive, we can treat it and prevent cervical cancer from ever occurring. Thank you.
Fantastic. So Abiodun, can you share with us a key takeaway? Oh yes, my audience are really impressed with that technology. I mean, it's very, very insightful to know that in less than a minute, a woman can know whether they have cervical cancer or no. So that's really next level technology, and that's really what some of the last mile cancer technologies we're talking about here today. Thank you so much. So Abiodun, can you share with us one key takeaway that you want the audience to go with today?
Okay, so I'm hoping that in the audience we'll have the leaders and the cancer activists, people who are actually fighting for who are patients of cancer. I want to say that we should not work in silos. I'm always very big on collaboration. Let's look out for other people who are doing great things, people who have strengths in the areas where we have weaknesses, for example, and let's work together so that together we can actually make bigger efforts and really start our journey to closing the gap.
Right. Collaboration for growth, collaboration for success. We can make so much impact by collaborating. Dr. Deniji, one key takeaway.
Thank you. So quickly, I would like to say this. When it comes to information on cancer, I want this to be the takeaway from me. Let us try as much as possible. I know a lot of people try to know about cancer. We need to verify the information. I see a lot of people who come in with wrong information, and they've been with that information for a while. So cancer this one can cause cancer, this one can cure cancer, and many of those things are not true. So let's verify information on cancer from the right sources. In as much as we are going digitally on social media, everywhere to get information, let's get the right information from the right sources. Thank you very much.
Thank you so much. And Dr. Matthew, one key message to leave the audience so that we can close out the session.
Yeah, sure. I guess for me, in terms of just real digital health focus for cancer care, I think it's just not enough to ask people with cancer for their data. So I think patients and caregivers need to be central to digital health development, and I think interventions need to meet their needs. It can't just be back gathering data. So I think crucial next steps are going to be developing platforms that can really engage patients and their caregivers, such as generating personalised guidance and feedback on how to manage symptoms, or include resources that are really interested and useful to patients and their caregivers. So, yeah, I think that's mine. We just need to ensure patients' caregiver involvement is a central component of any current or future digital health development.
Okay, so the role of patients and caregivers in the cancer care continuum. Thank you so much, Dr. Matthew. Thank you all of you for staying with us to the end of this session. I mean, it has been insightful, it has been practical, and most importantly, it has been data-driven. We have another poll for you. Please share with us what emoji best describes your feeling at the end of this session so that we know how much we've impacted you. From my end, I would like to say one key session will be if you're dealing with cancer, if you know anyone affected by cancer, if you have a loved one or you just know anyone, please download the Oncopadi Cancer app. You can visit us at www.oncopadi.com and we can connect you immediately to the cancer resources. It connects you to resources, connects you to tools, connects you to support services, connects you to coping centers and clinics that can help you, support you with your care. And if you're looking to work with us or if you're interested in supporting the work we do at Oncopadi Technologies Limited, please feel free to meet with my team members at the back or feel free to speak with me at the end of this session. Thank you so much for your time and have a wonderful day.
Hello, my name is Abiodun Owo. I work with Aspire Coronation Trust Foundation and I'm here as a speaker to talk about increasing survival rates in cancer care in Africa. I would like to say for us to effectively treat cancer, it's important that we get screened because it's important that we know on time so that people do not present late and then they get the kind of care that they need. So if you have never done a cervical cancer screening, if you have not done a breast cancer screening, or even for prostate cancer, I'd advise that you go now to the nearest clinic around you Oncopadi is also available for you. You can download their app, that's Oncopadi app, and you get all the information and services that you need. You can prevent cancer today. Thank you.
Hello, my name is Dr. Lola Salako. I'm a clinical oncologist and lecturer at the College of Medicine, University of Lagos. I'm also the founder of Oncopadi Cancer app, and today we hosted a panel session titled Last Mile Cancer Technologies, and this just talks about the various technologies we are using in Nigeria and Africa to help patients understand cancer, to have the right expectations, have the right information so that they can make good healthcare decisions, and most importantly to support them on their journey. And the Oncopadi app, which basically is a last mile technology because it delivers cancer care to the patient wherever they are. It may be the patient or it may be their relative. Our users are able to conduct a virtual consultation via their telephone with a cancer specialist like myself. They're also able to read the articles, watch the videos that educate them about cancer and provides them with coping resources. So last mile cancer technologies are critical to address the shortage of cancer specialists in the country. And it's one way we must all look towards and invest in so that cancer patients and their caregivers can get the support whilst they are battling cancer.
Hello viewers, I'm Dr. Adeoluwa Adeniji. I am the Chief Medical Director of Mikio Cancer Center. So basically, AFRICANXT program that we've come to do is about the role of digital platform in cancer care, innovations in cancer care. So as much as possible, I'm going to emphasize that we bring digital care or digital platform to the forefront of cancer care, because without innovation, we cannot get the best of cancer care for the people that really need it. So we need collaborations, we need resources, we need super fast internet facilities, we need everything to be able to bring the best of the care that people enjoy around the world, to Nigerian cancer patients. And that is what I'm going to emphasize here. As much as possible, let's collaborate, let's work together. Let's make digital platform, a good one that people can take advantage of as they receive cancer care in Nigeria and even outside Nigeria. Thank you very much.
Hello, my name is Agnes Mana, and then today's session was very, very educative. And then I get to learn that despite the shortage of oncologists in Nigeria, a lot of people like Oncopadi are putting in hard work to make sure that people living in remote areas get access to cancer tech solutions. It's good to know that a lot of people are considerate about making sure that everyone in the cancer space, both patients, health workers and caregivers, have their solution.
Hi, my name is Tomiwa Ubielodon. The session was very interactive. I learned about how we can use technology to better improve health in Nigeria and Africa as a whole, and the important things people have been doing in the cancer space, like make cure and Pearl Oncology.
Hi, my name is Owen. Today's session was really enlightening. We talked so much about how technology can influence the care of cancer patients, and the needs are really rising now in Nigeria. And it was so amazing to learn about the different ways that people have been impacting the healthcare system through technology, especially for the cancer care in Nigeria. It was amazing.
We at Oncopadi Technologies Limited have developed simple, user-friendly and innovative solutions that are helping cancer patients and their caregivers access coping resources to support them on their cancer journey. If you know anyone that is affected by cancer, a loved one, or just anyone affected by cancer, please visit www.oncopadi.com today to get all the resources that you need to achieve a successful life on your cancer journey. Thank you.